Welcome to Garage Gym Athlete Cool Downs. These episodes are short, actionable podcasts pulled from previous interviews and content we've been publishing for the last several years. So go for a walk, hop on the rower, or clip into the bike for this cool down episode.
You know, I grew up eating pretty much just real food. My parents cooked a lot, so I never was somebody who was eating a lot of fast food, but I was just eating what I thought was the healthy way of eating, you know, mostly vegetables, absolutely no fat, and some sources of protein. And when I was in my 20s, I was a medical student, and we had to do some lab work just basically to get like $50 off of our medical insurance. So I was like, all right, I'll do it. And the labs were basically like a basic chemistry to look at our kidney function, stuff like that. And then a hemoglobin A1C. And based on those tests, I found out that I was insulin resistant and pre-diabetic. And to kind of paint the picture, I was 24. I had a six-pack. I was exercising like crazy. I was doing like half Ironmans in triathlon. So I was really, really healthy in my book. So when I got those labs back, I was pretty stunned. And, you know, as a medical student, I figured I knew a lot about health and realized, oh my God, I'm telling people to do something and look at what's happening to me. And so at the time, you know, the internet wasn't that big. There wasn't that much information, but there was some information out there on Atkins. And so I started looking into Atkins and started to try it myself, and didn't really find, you know, tremendous success because I wasn't trying to lose weight. I didn't really like the way the foods were. But from that, I kind of started doing a lot more research on metabolism, you know, the biochemistry, and figured out that a lot of what we're promoting in kind of our Western way of living is based on a faulty premise. And that faulty premise is that saturated fat causes cardiovascular disease or heart disease or stroke. And so I started going back and reading the research that was available. And through time, kind of realized that, hey, you know what, actually fat is not necessarily the enemy. And if you correlate kind of what was happening in terms of metabolic diseases, diabetes, hypertension, cardiovascular disease, we started really seeing a rise in that when we started saying, hey, you know what, fat is bad for you. And so it's been an evolution in terms of my own personal journey to getting healthy. And so I started doing more fat in my diet, more protein, kind of minimizing the refined carbohydrates and the simple carbohydrates, and basically redid those tests. And that also included fasting insulin and something called high sensitive CRP, which is kind of a marker of inflammation. And after 3 months, actually, my lab results were back to basically normal. And so that for me was a really eye-opening experience. So fast forward about 7 years or so, I'm now a board-certified doc in internal medicine, and I'm working as a hospitalist, which is basically the doctor that works in the hospital and takes care of you. And at the time, I decided I was going to go to the rural South. So I went to Mississippi. And, you know, when you're young, you're kind of idealistic. I figured I'm going to really help change the system, try to improve health overall. And I figured I'd go to the worst place in the country to do that in terms of health outcomes, which is either Louisiana, Mississippi, or Alabama. And so I worked there, and really my experience there was both eye-opening and traumatic in the sense that I saw young people, like people in their 20s, 30s, 40s, having all these complications of diabetes that was really based not on genetic predisposition. It was based on just their diet. So, you know, in medical school and residency, we're taught to look for certain diseases at certain ages. So if somebody's coming in with chest pain, for instance, and they're in their 20s, well, we don't think that they're having a heart attack. We don't think that they're actually having, you know, severe cardiovascular disease. But in Mississippi, we would find people who were in their 20s, 30s having massive heart attacks, heart failure, being on dialysis, having strokes. And all that was really based on what they were eating. And so for me, that was really eye-opening in the sense that there is something definitely going wrong with our message, which is, you know, you shouldn't eat fat because it's going to make you have a heart attack. And at the same time, people started kind of questioning, you know, me and my wife and how we were raising our kids because we were healthy, but they also noticed that we were eating a lot of fat. And so I had a lot of people start asking me questions in terms of, hey, what are you doing? Because obviously you guys are doing something right. And so I kind of made a transition at that time, which was about 6 years ago, to start helping people around me. And it was kind of just a grassroots kind of effort where people would come to me and say, hey, I need you to help me. And so I would start helping people start off by, tweaking their nutrition, starting to go low carb or keto. And it wasn't as big at the time as it is starting to become now, but people would get amazing results and they would feel, amazing. Their lab work would improve. They would get off certain medications. And so for me as a doctor, I felt like I was doing a bigger service to people in that fashion than trying to help kind of what I call sick care, which is after the fact. If you've had a heart attack, you've been in a car accident, you've had a stroke, you definitely want to be in the United States because we are fantastic at doing something after the fact. But I realized that we weren't really doing what we needed to before to prevent all that. And it showed in all the numbers. Any metrics that you want to look at, reflects that. But I also noticed that people would tend to only get so far with just nutrition. So a lot of people I was working with, didn't exercise, weren't focusing on their sleep, weren't focusing on certain other things. And so I realized, they needed to start incorporating some more of these things, biohack, which is also kind of becoming popular now. But at the time, people were not really in tune with other things like cold thermogenesis, sauna, exercise, sleep, stress reduction. So it was kind of an organic growth in the sense that I started incorporating those things into people's kind of programs, and lo and behold, they would start feeling even better. They would sleep better. They would be eating better. Their stress levels would improve, and so sorry to make it kind of a long story, but it was kind of a normal organic genesis to get to the point where realizing that overall health and longevity goes beyond just nutrition. It incorporates all these other factors in our life that maybe we're not really focusing on.
And that is quite a journey. I think,
Yeah.
No, I think that's awesome how you've really come, full circle, moving from you call sick care to preventative care. Why do you think it's tough for doctors to move that direction? I know that it probably wasn't easy for you to, maybe I would say professionally, to do that. Do you find that to be challenging for doctors these days? Maybe other doctors have the same ideas but can't make that shift?
Absolutely. Yeah. I mean, I think for a number of reasons, but number one, I think in general, most physicians, and I'll probably get skewed for saying this, but most physicians are not going to necessarily think in terms of like an entrepreneur spirit. They're going to be more of, not 9 to 5, but going to be salaried employees. We're taught a certain way in the sense that it's almost like a patriarchal system where we are taught this is the information that you need to tell people. If you have this disease, this is how you're treating it. But the focus is rarely on prevention. It's usually after the fact. And there is lip service given in terms of like, when somebody comes in and they have some elevated sugar, tell them diet and exercise, but we never really go into what that actually entails. And I don't know if you've gone to a physician and you probably don't have this issue, but I'm sure some listeners would, where their doctor just says, you need to lose 20 pounds, just diet and exercise. But rarely do we actually go into what that actually entails. So I think, number one, most physicians at this point who are primary care docs don't have the time to go into what diet and exercise means. And number two, probably really don't know what that necessarily means. I mean, you can tell somebody to run 30 minutes on a treadmill, but is that the most efficient way to really optimize yourself? Dietary wise, we have to base what we say on the USDA guidelines, which still promote, low fat, carbohydrates and healthy grains and protein. And just recently, the AHA, the American Heart Association, started saying, okay, we need to reduce refined sugars and added sugars. But up until then, they were still recommending a lot of sugars for people. And so as a physician, you're kind of obligated to stick to that talking point, even if you feel that it's wrong. And if you go outside of that, then you open yourself up to some kind of liability, which I think a lot of people are adverse to. An example would be, like if I took care of a patient and I told them the exact right thing to do, but it wasn't based on these guidelines, and something bad happened to them that was irrespective of me, what I was telling them, they just happened to have something happen, well, then I would probably be liable. And the flip side of that is if I told them the exact guidelines and they still had the same outcome, but I was telling them the exact guidelines, then I would be safe from a legal perspective. And so I think a lot of people are risk adverse in that sense, where they don't want to open themselves up to liability, which I understand. But from my perspective, I went into this to actually really, truly help change people's lives. And so I felt it was kind of unethical to be telling people what I felt was the wrong thing, just to kind of protect myself, if that makes sense.
Yeah, that makes perfect sense. I think kind of getting into the system and then also kind of trying to cover your own tail most of the time is definitely probably a necessity, but unfortunately not the best thing that we could do for everyone out there. Thanks for listening to today's Cool Down. If for some ridiculous reason you are not subscribed to Garage Gym Athlete Programming, fix that problem right now. Go to garagegymathlete.com, sign up for a free trial, get started with us today. Thanks for listening.